Ear. The ear is the organ of hearing and balance. It has three parts. The first part is the external ear, consisting of the part attached to the lateral aspect of the head and the canal leading inward. The second part is the middle ear, a cavity in the petrous part of the temporal bone bounded laterally, and separated from the external canal by a membrane and connected internally to the pharynx by a narrow tube. The third part is the internal ear, consisting of a series of cavities within the petrous part of the temporal bone between the middle ear laterally and the internal acoustic meatus medially. The internal ear converts the mechanical signals received from the middle ear, which start as sound captured by the external ear, into electrical signals to transfer information to the brain. The internal ear also contains receptors that detect motion and position. External ear. The external ear consists of two parts. The part projecting from the side of the head is the auricle, pinna, and the canal leading inward is the external acoustic meatus. Auricle. The auricle is on the side of the head and assists in capturing sound. It consists of cartilage covered with skin and arranged in a pattern of various elevations and depressions. The large outside rim of the auricle is the helix. It ends inferiorly at the fleshy lobule, the only part of the auricle not supported by cartilage. The hollow center of the auricle is the concha of the auricle. The external acoustic meatus leaves from the depths of this area. Just anterior to the opening of the external acoustic meatus, in front of the concha, is an elevation, the tragus. Opposite the tragus, and above the fleshy lobule, is another elevation, the antitragus. A smaller curved rim, parallel and anterior to the helix, is the antihelix. Muscles. Numerous intrinsic and extrinsic muscles are associated with the auricle. The intrinsic muscles pass between the cartilaginous parts of the auricle and may change the shape of the auricle. The extrinsic muscles, the anterior, superior, and posterior auricular muscles, pass from the scalp or skull to the auricle and may also play a role in positioning of the auricle. Both groups of muscles are innervated by the facial nerve. Innervation. Sensory innervation of the auricle is from many sources. The outer, more superficial surfaces of the auricle are supplied by the great auricular nerve, anterior and posterior inferior portions, and the lesser occipital nerve, posterior-superior portion, from the cervical plexus and the auriculotemporal branch of the mandibular nerve, antero-superior portion. The deeper parts of the auricle are supplied by the vagus nerve, the auricular branch, and the facial nerve, which sends a branch to the auricular branch of the vagus nerve. Vessels. The arterial supply to the auricle is from numerous sources. The external carotid artery supplies the posterior auricular artery, the superficial temporal artery supplies anterior auricular branches, and the occipital artery supplies a branch. Venous drainage is through vessels following the arteries. Lymphatic drainage of the auricle passes anteriorly into parotid nodes and posteriorly into mastoid nodes, and possibly into the upper deep cervical nodes. External acoustic meatus. The external acoustic meatus extends from the deepest part of the concha to the tympanic membrane eardrum, a distance of approximately 1 inch, 2.5 centimeter. Its walls consist of cartilage and bone. The lateral 1/3 is formed from cartilaginous extensions from some of the auricular cartilages, and the medial 2/3 is a bony tunnel in the temporal bone. Throughout its length the external acoustic meatus is covered with skin, some of which contains hair and modified sweat glands producing cerumen, earwax. Its diameter varies, being wider laterally and narrow medially. The external acoustic meatus does not follow a straight course. From the external opening it passes upward in an anterior direction, then turns slightly posteriorly, still passing upward, and finally, turns again in an anterior direction with a slight descent. For examination purposes, observation of the external acoustic meatus and tympanic membrane can be improved by pulling the ear superiorly, posteriorly, and slightly laterally. Innervation. Sensory innervation of the external acoustic meatus is from several of the cranial nerves. The major sensory input travels through branches of the auriculotemporal nerve, a branch of the mandibular nerve, anterior and superior walls, and in the auricular branch of the vagus nerve, posterior and inferior walls. A minor sensory input may also come from a branch of the facial nerve to the auricular branch of the vagus nerve. Tympanic membrane. The tympanic membrane separates the external acoustic meatus from the middle ear. It is at an angle, sloping medially from top to bottom and posteriorly to anteriorly. Its lateral surface therefore faces inferiorly and anteriorly. It consists of a connective tissue core lined with skin on the outside and mucous membrane on the inside. Around the periphery of the tympanic membrane a fibrocartilaginous ring attaches it to the tympanic part of the temporal bone. At its center, a concavity is produced by the attachment on its internal surface of the lower end of the handle of the malleus, part of the malleus bone in the middle ear. This point of attachment is the umbo of the tympanic membrane. Antero-inferior to the umbo of the tympanic membrane a bright reflection of light, referred to as the cone of light, is usually visible when examining the tympanic membrane with an otoscope. Superior to the umbo in an anterior direction is the attachment of the rest of the handle of the malleus. At the most superior extent of this line of attachment a small bulge in the membrane marks the position of the lateral process of the malleus as it projects against the internal surface of the tympanic membrane. Extending away from this elevation, on the internal surface of the membrane, are the anterior and posterior malleolar folds. Superior to these folds the tympanic membrane is thin and slack, the pars flaccida, whereas the rest of the membrane is thick and taut, the pars tensa. Innervation. Innervation of the external and internal surfaces of the tympanic membrane is by several cranial nerves. Sensory innervation of the skin on the outer surface of the tympanic membrane is primarily by the auriculotemporal nerve, a branch of the mandibular nerve with additional participation of the auricular branch of the vagus nerve, a small contribution by a branch of the facial nerve to the auricular branch of the vagus nerve, and possibly a contribution from the glossopharyngeal nerve. Sensory innervation of the mucous membrane on the inner surface of the tympanic membrane is carried entirely by the glossopharyngeal nerve.